Patient Education Lesson 4. Our lesson today is on the determinants of learning and some of the opportunities and challenges for the clinician in educating our patients. To meet these challenges, the clinician must determine how well the patient learns. The determinants of learning are 1. Learning needs, 2. Readiness to learn, and 3. Learning styles. We will discover the components of each of these categories to further improve our ability to educate our patients. Although all learning does not require a teacher, clinicians play a vital role as facilitators of learning, and as such must not only provide information, but must assess any problems or deficits that impede learning, present information in unique and appropriate ways, identify progress being made, provide feedback and follow-up, reinforce learning and the attainment of new knowledge, skills, and attitudes, and evaluate the learner's abilities. Although patients may make decisions on their own without the clinician's assistance, they may be limited or inappropriate. The clinician's role is to support, encourage, and to provide direction and create an optimal environment for learning to occur. As clinicians, we are used to assessing our patients. This assessment is a critical element in evaluating our patient's needs, readiness, and style of learning. Learning needs are described as what the learner needs to learn. Readiness to learn is when the learner is receptive to learning, and learning styles assess how the learner learns best. Assessment is such a critical step in assuring the best possible learning outcome and reducing stress and anxiety for the learner, but is often skipped due to lack of time. When assessing learning needs, the educator must follow these important steps. 1. Identify the learner. Who is the audience? Is it one person or many? Do they have a single need or many needs that need fulfilling? 2. Choose the right setting. Ensuring privacy and confidentiality are required here. 3. Collect important information about the learner. Explore the health problems or issues that are important to the patient and their families and what support systems exist and assist them in prioritizing needs. 4. Involve members of the healthcare team and help determine other educational sources such as the American Heart Association, etc. 5. Prioritize needs. Patients with multiple concerns may need help in determining which ones are more important. 6. Determine availability of educational resources. If some resources are unavailable or inappropriate, the clinician must be able to switch gears and work with the patient's most immediate needs and concerns. 7. Assess the demands of the organization. What are the organization's mission, strategic plan, and goals? The clinician must also be familiar with the hospital professional and agency regulations. Lastly, number 8, take time management issues into account. This includes performing a thorough learning assessment to avoid wasted time spent on going back and identifying issues later, helping the patient identify priorities of needs to make things easier to move on to other necessary content, looking for opportunities for learning, such as while making rounds or giving treatments, giving advance notice of times for education so the patient and families have time to prepare questions and concerns, and minimizing interruptions so that assessments and learning are able to be completed efficiently. When prioritizing needs, mandatory needs are defined as those necessary for survival and safety, and desirable needs are those that are not life-dependent but are related to well-being. To assess learning needs, the clinician may obtain this information by informal conversations, structured interviews, questionnaires, observations, and documentations. Structured interviews are the most commonly used way to solicit the patient's point of view. Some effective questions may be, what do you think caused your problem? How severe is your illness? What do you do to stay healthy? How do you learn best? When assessing readiness to learn, there are 4 categories to evaluate. They are physical readiness, emotional readiness, experiential readiness, and knowledge readiness. Physical readiness is determined by evaluating the patient's physical abilities such as strength, flexibility, coordination, and endurance, the complexity of the task, which means is it a one or many steps to complete, or is it a skill that is new or needs to be relearned, the environmental effects, which can be positive, such as a quiet, peaceful environment, or unfavorable, such as noisy, stressful, or rushed, health status, which assesses the patient's amount of energy available for learning, and gender, which may affect receptiveness and risk-taking. Emotional readiness assesses the role of anxiety level in the person's ability to perform a task, concentrate, and retain information. It also evaluates the support system, which may aid in assisting with self-care and adherence to medical regimens, and as reinforcements for learning motivation, which is the ability to take action, risk-taking behavior, frame of mind, which is concerned with the here and now and developmental stage, which influences peak times for readiness to learn. Experiential readiness describes the level of aspiration, which looks at the patient's past experiences with learning and whether they were successful or not, past coping mechanisms, which show how the patient dealt with past problems, cultural background, which influences belief systems and ability to understand information, such as information presented in a non-native language or with overly complex medical terminology, locus of control, which centers on how patients are internally motivated to learn, and orientation, which is a tendency to adhere to a parochial or cosmopolitan point of view. Lastly, knowledge readiness refers to the patient's present knowledge base, learning capability, existence of learning disabilities, and preferred style of learning.